Let's just start with your timeline. Tell us about how you found out you had scoliosis and sort of what the process of your journey looked like.
Okay, great. I feel like my journey, comparatively, was just so much more in the dark right away after hearing your story. I'm like, I didn't know anything. I wasn't aware of any of this stuff. So I discovered it later. I think I was officially diagnosed at 14. And I remember being at summer camp. I went to military camp, which isn't as dramatic as it sounds. It was like a fun military camp. And we would march and like stand at attention, and we had to like parades, like marching parades and stuff. I had to stand at attention for really long periods of time, and I would just notice my back would really hurt, specifically my mid back would really hurt. And I would just get so uncomfortable, and I would try to start like bending the other way, trying to overcompensate or something, but I didn't know what it was. And so I talked to my dad about it. Right away I just started getting massages, which I was kind of young for getting massages. Not a lot of like 13-year-olds would go to a massage place. Nothing was helping, and I didn't know what scoliosis was, didn't think about that. I had a doctor one day doing a checkup, and I was specifically for my back pain. I came in because of the back pain. And they had me do the bend over, touch your toes thing, and they were like, you obviously have scoliosis. And it's like, I had no idea, like, how did we not think of it? And it seemed very like, well, duh. Like, I had one of those moments. But they were like, yeah, there's nothing really to do. We'll just monitor it, see if it gets worse, and be on your way. And they didn't give me any exercises or any ideas of what it was. I asked, I was like, is there anything that'll make it better? And they said no. I was like, okay, great. So then I just like went on with my life, not thinking about it. Back pain continued to get worse. It was, it started as a very achy tightness, especially on my right side, primarily, that would radiate out through my whole back, but it was primarily just like right here on my back, and it just always felt like something was being pinched or something was being shoved. I had my first initial diagnosis at 14, and then I came back a couple years later, beginning of my junior year, so I was 16 turning 17. We got another x-ray, and I guess, I don't remember my angles, I don't remember the percentages, but it basically doubled in that time. That really scared everybody, and I can't stress enough how little I understood of what was going on, how in the dark I was. I didn't have the context for what it was, so I couldn't grab onto any information. So the doctor came in and told me, he's like, we have to do surgery. And I was like, okay, that's the only thing to do. I asked, like, is there anything else? And he was like, no, you need surgery. You have to have it. If you don't get it, you're gonna die. One day, he's like, your life is gonna get harder and harder. And I remember him saying that, especially because of the rate of which my curve was progressing. Oh, and by the way, it's a C curve, so I look like a question mark. I'm like, whoop. But because of how fast it was progressing and where my angle was, my lungs would get smushed one day. And that stuck with me. I was like, that sounds bad. I won't do that. So I remember in the day they were like, do you want to do the surgery? And I was like, yeah, sure. Just because that was the only information I was getting. And again, I couldn't comprehend what was going on. And then I just had a doctor telling me, you need surgery. And so I was like, well, then I'll do that. I'm embarrassed by how little I was thinking about any of this stuff. Like, I just had other stuff on my mind. I was 16, 17 years old. I wanted this pain gone. I really wanted it gone. And I asked, I was like, is the pain gonna go away? And they said they couldn't promise anything about the pain. It could help potentially, but the thing that it could do is stop the progression. That was the main reason for the surgery, was just to stop it from getting worse and worse. And I remember being bummed out about pain, because that's the thing, you know, it was starting to get to the point where it was taking up a lot of my energy, just feeling it, like always being in at least some kind of pain. So it was disappointing to hear that, but I remained hopeful. You know, in a way, I'm grateful that I didn't have my brain fully developed at the time, because I just went into the surgery super brave. It was almost like I was thinking of it like, hey, this is an adventure. I've never had surgery before. How exciting. I remember being like, oh, you have to take 6 weeks off of school. And I was like, that's great. Like, I hate school. It's junior year. Like, that's like the hardest year. I had a lot of, like, junior year was specifically tough. I think it's specifically tough for a lot of teenagers. So I was like, I don't have to go to school for 6 weeks. That's awesome. I'm gonna get so much attention. People are gonna come and give me flowers. Like, this is so great. I love attention. So I remember getting ready for the surgery, and I'm thinking, like, oh, what am I gonna do with all my time? Like, I'm gonna have 6 weeks where I don't have to go to school. Maybe I'll start baking. Maybe I'll get into knitting, or maybe I'll get in, you know, like thinking like just no idea about what was about to happen. I go into surgery very optimistic. I remember the nurses being like, you're cheery. And I was just like, yeah, like, I'm just happy to be here, excited for this adventure. Like, I really didn't know what was about to happen. And I think in a way that served me, because I was excited going into it. And I think that optimism had something to do with my healing, or potentially, I don't know. But I remember waking up from the surgery and being blindsided, just absolutely blindsided by the pain. And yeah, like, it was like I woke up, and it was, you know, the Eye of Sauron in Lord of the Rings? It was like that. It's like I was in the Eye of Sauron, where it just felt like, I mean, it literally felt like this, because it was literally what happened. It felt like somebody had flayed off all of my muscles from my spine, rammed in some rods and screws, and stitched me back up, and then threw me on a bed. And it was a surprise. I don't know if people told me that it was gonna be painful, or what exactly. Like, I remember opening my eyes and just grabbing onto something, and like, it was very scary. And the time in the hospital, I remember just spending time on my back, and I would just be laying on my back, lay there for like 3 hours, and then it would get, like, my back was on fire. So it's like, okay, now I have to turn to my right side, and that would take about 10 minutes or so, just trying to inch your way over to your right side. And then you would have this moment of relief where you could breathe for a second. And then it's like restarting the clock, where it would just get like, it's like, oh, have that relief. That's better. And then it would just get more and more painful, until the point where you felt like you were on fire again, and you're like, okay, that's my hint. I have to go to my left side now. And then that's another 10 minutes of trying to move. And like, and I very quickly learned, it's like, oh, that's what I'm gonna be doing for the 6 weeks off. I'm gonna be relearning how to move. I'm gonna be learning how to walk again. I mean, obviously I knew how to walk, but you know, I didn't realize how often you're using your back, like that you use it for every single movement, you use your spine. Every single movement felt like that fiery pain. And then some more like traumatic things happened in the hospital, in like dealing with Foley catheters and those kinds of things, which just added to the fun, I guess. But then I remember my dad works in medicine, and so he was talking to the doctor, and I really trusted my dad because he works in medicine, so I was like, you know what you're doing. He asked the doctor about physical therapy for after surgery, and the doctor, who's just like really, you could tell he was really smart, but he's just not very personable, and he was just like, no, you don't need it. You don't need it. And we were like, really? Like, you don't need any physical therapy after spine surgery?
How long was your surgery?
Like the actual, like, I was under about 9 hours. Yeah, because and that's important too, I guess. It was from T1 to L2, I believe. So, yeah, like my entire thoracic spine down into a little bit of my lumbar. Yeah, 9 hours of surgery.
And then they didn't feel like physical therapy was necessary.
They said it was completely unnecessary and that all I would need to do is start walking. And they did stress that. They were like, just walk as soon as you can and do your little laps of walking. And they said that that's all I would need to start feeling better. I'm a little bit mad at them for that because I believed them. You know, like, and I think that's a theme I'm noticing and looking back is I didn't know what was going on. I looked to these doctors and I asked them, what do I need? And they said this, and then I just went with it. And then I had the surgery. I think I only did 4 weeks off of school because I got really excited to get back to my normal life. I didn't really I realized very quickly that it wasn't going to be the fun vacation that I thought it was going to be. I was like, oh, this just sucks. So I remember having I had a half day where I would go to school for half the amount of time, and I was allowed to go and swim. And that was the thing that my dad and I decided was like, that's something I'll do. Like, that'll be my PT. Is like, I'm going to go and swim, just do breaststroke. And the idea was to have like low impact, but keep it moving.
And probably the water being cold helped too.
Yeah. And that was nice. I think I liked doing that. And I did like getting attention. I did get attention. That was very exciting for me. I just kind of went back on autopilot again afterwards. And I remember right away, I tried getting back into sports. I played volleyball in high school and working out. I wanted to, just be like a normal kid. I didn't think of it as a big deal. Mm-hmm. It wasn't presented to me like it was a big deal. When it started to take up more of my time and my life and my energy, it was confusing. So I just kind of turned it off. I was just like, all right, I'm just not gonna worry about it, not gonna think about it. I'm gonna go back to doing everything else that I would normally do. And I remember the next year, my senior year, playing volleyball, I couldn't make it through a game. I would have to have like these like emergency layouts where like it's like I'm doing okay, and then like my back would just like seize up and I would just hit the floor and just go on the ground and just try to like lengthen it out whatever possible. I don't think I did anything for maintenance except for occasional massages. I've always liked massages. I remember always thinking that like this is going to be the massage that fixes it. Like this is going to be the one where it's going to get rid of all of my pain. And I just couldn't wait for that moment. I remember fantasizing about like, this is going to sound weird, but like I remember just because the pain is just so intense and it just feels so constricting. And so in my head, it was like, if I just like shove everything the other direction, or if I break my spine, like I would have these fantasies of breaking my back, like be like, if I just threw myself off of a building really quick and landed in a way that like,
it would fix it.
Yeah, like pop it into place. And like, cause there's all these like cartoons or in movies or something when somebody I can picture a cartoon where like,
like
Tom and Jerry's like getting pulled, and then they pop and they're like, it's like, I wanted that so bad. I'm just like, just pull my head off. I don't care, just do something. Like, I just need this to straighten out. That never happened. I remember once I was in college, again, I was expecting it to just kind of fix itself or just not be an issue anymore. And I had to walk to class. I had a big backpack carrying all my books. I was never smart about any of this. Like, I could have been the kid with like a rolly backpack or something, but I never was. It's like, I'm gonna get a backpack, make it go hang low, like just such not wise decisions. But again, I didn't know. I would be walking to class, my right arm would go completely numb. And numb is kind of a weird word for it because it hurts. It's like numb, but with pain. And it would be like these shooting pains from underneath my scapula down to my pinky. It would feel like it would fall asleep. And so I would like walk to class, and then as soon as I would get into a building, I would throw my backpack off and then just ram myself into a wall or a corner and just like be like a big bear and just kind of go like this, like it was normal. Like, that's a normal thing to do. And but sometimes it's like I had to like run into the room because I'm like, I have to get this backpack off. Like it would just be like fiery kind of pain. So that gets me up through college, and after school I went to massage therapy school afterwards because then I was like, I'm gonna be an actor, and then massage therapy will be a great, what is it, like side hustle kind of job,
like day job thing.
Yeah, and I'm really good at giving massages. And everybody's like, wow, it's like you know where every knot is in my back. And I'm like, it's because I have every knot. Like, I have every single pain that you can have in your back. Like, I know where it is. And I really liked giving massages. It was really therapeutic for me. And then one of the perks of massage school is that you get a massage almost every day. Right. You give a massage and then you get a massage, and it was amazing. I thought that was gonna help. I really did. I thought if I just, and at that point I started doing yoga, and I was thinking with the combination of massage and yoga, I would get to a point where I was fine. That did not happen. So I just wanted there to be that one moment where everything would go into place and I wouldn't deal with the pain anymore. But I was giving massages and I really liked it. I still really like giving massages. But it got to the point, like, I was doing that for a couple of years, and it got to the point where, and I don't think I've been the wisest throughout my entire back process. I was like, yeah, I'll be a traveling massage therapist and I'll carry my massage table. Yeah, in New Mexico it was fine because there's always parking and everything is single story. So it was doable, and that was still when I was like newer in my massage career. But then once I moved out to LA, I brought my table, and that the plan was to be another traveling massage therapist. And I did that for like the first 6 months or so of me living here, and it was horrible. Because first of all, it was just like practically speaking, there was never any parking. So I would be like street parking and then walking like a block and a half with my freaking massage table. Then I would get to the apartment complex and have to walk upstairs with my massage table, then get into the apartment and set up the table, and then give an hour and a half long massage. Like, it got to the point where I was mad at my clients because I was like, your back doesn't hurt. My back hurts, and I'm just like I would get jealous of them. I would be like working on them and I'd be like, I want this. Like, what? It's like, can you massage me now? Like, it was so, and so I was just like, I don't think I can do this anymore. Like, this just isn't like sustainable. And then, so I stopped traveling, And so I thought maybe if I just had a place, my own place, and I would massage. But at that point, I was like 26, I think, is when I first started throwing out my back regularly. And that's when the pain started to change. Like, it was always kind of concentrated in my right middle back. When I was, 26 or so is when it started to go to different areas in my back. It started to get my lower back, I think I was pushing myself in yoga and doing these back bends in yoga, not thinking about the fact that I had rods going down into my lumbar spine. So I was just like pushing it. And so I started throwing out my lower back regularly. I got a pinched nerve in my neck and left shoulder that since then it hasn't been the same. I always have this pinching feeling in my left shoulder. So your ribs are pretty movable because you have to breathe all the time, right? That cartilage area, your ribs can pop out of place. And so I think the first time my rib popped out of place, I felt like I got stabbed in my spine and I couldn't breathe. It was a very scary feeling. I went to the ER to make sure that I thought maybe my rod broke and that I was being stabbed by it was so scary. That became a pretty common occurrence. And I remember when I went to the ER for the first time, my rib popped out. The doctor was just yeah, ribs pop out. They pop back in. Okay. And I was just like, thank you for that. And so continuing on with this theme of not getting any information, not getting any tools on how to maintain, and just kind of going with it and just being dictated by whether my back hurt that day or not. I'm an actor, and so I would be spending days on set just in so much pain. It's so conflicting because I'm so excited to be on set in a costume with people doing my makeup and stuff, and then feeling like my whole torso is just a block of just discomfort, and it was getting really difficult to fully embody a character when you're in chronic, very real pain. So after my pinched nerve in my left shoulder, it was a combination of a pinched nerve in my left and a rib slipping out on my right side. I couldn't move my neck. And every time I would be getting into and out of the car, I looked like an old lady, just trying just trying to move whole body with it. And I'm like, I'm 26 years old. I'm 27. It's this isn't normal. And then I remember thinking that, well, this sure as hell isn't going to get better with age. Backs don't get better with age. And so I went to the doctor specifically about the pinched nerve, and she did some palpitations and was like, well, we should do another x-ray, make sure everything is okay. When I got the x-ray back, she told me that, so along my spine, I had 2 rods with screws alongside, and at the top of the rods, there are these hooks that hold on. The idea was that they would be stabilizing hooks, where they would just kind of be guides for where, making sure that the rod stayed in the same place. And then my bone would fuse over the rod and it would all become one. But at some point in time, we have no idea when, one of the hooks had slipped off of my vertebra and had jammed itself between my right scapula and my spine. It was simultaneously bad news and very validating at the same time. It was one of those things of well, yeah, no wonder my back hurts specifically there. It was it almost felt good to know oh, there's a reason why it hurts, because there's something there that shouldn't be there. That was good information to have. so right away, the doctor I was seeing, she was like, well, we should get that out. So I'm going to set you up with a neurosurgeon consultation. I went and I was very optimistic. I was excited. I was like, yeah, let's get this out. And the doctor was an asshole. Like, I was like, I'll just say it. He is an asshole. And I sat down and I told him about my back, and he was like, what's your daily pain like? And I was like, I probably, on a daily basis, hover around a 5. And I always get to an 8 or a 9 or so. Like, that's, yeah, there's always going to be a time, especially at that point where I had these pinched nerves and slipping ribs, and he was just like, I remember him like kind of chuckling when I told him how much pain I was in, and he was like, you look fine, like you're sitting here. And I was like, yeah, but I'm in pain right now, actually. and he's like, well, the surgery probably wouldn't help with that. And I was like, but there's a hunk of metal in the wrong spot in my back. And he's like, I can't promise that it would help. I mean, I'll do it if you want me to do it, but probably not going to do anything. That was really heartbreaking. I asked, I was like, is there anything that you would suggest I do? And he's like, no. I was like, okay. I mean, I work out, I stretch, I do all of these things. And he's like, you can keep trying to do that if you want. And it was just like so disheartening. It was so invalidating of everything. And I would tell him, like, I was like, I think it's my rib popping out. And he's like, your rib? like he was such a jerk. And so I left that appointment in tears, just with that feeling of like, it's not gonna get better. It's like this, and it's not gonna get better. There's nothing I can do. And that means that my back's just gonna get worse. It's just gonna keep getting worse. And so I got pretty mad at doctors at that point, and I asked for physical therapy. They gave me 2, I think a month of physical therapy, and it was very simple physical therapy, it was like, oh, do this ab exercise, and, like things that did help. Like, it's nice. It's always good to have some physical therapy, but it was only because I was like, can you give me physical therapy? After 4 sessions of that, insurance stopped paying for it. I was like, can I get acupuncture? Can I do, I asked them for everything, every resource, and I used it all up. There was nothing that was actually helping it. And so then once my insurance cut me off of acupuncture and physical therapy, I was like, okay, maybe I'll start weightlifting. And I got a trainer with the idea, and I told my trainers, this is for my back. I need this to make my back feel better. She was a really great personal trainer, and she understood that that was the main reason I was there, and that got better. And my lower back started feeling completely better. My lower back was fine, but then the pinched nerves in my shoulders kept flaring up, and when you sleep wrong and you get a crick in your neck, where you can't you can't move anything, that was happening so often that after doing that after working with weights consistently for a year, I was still throwing out my back and my neck specifically, and it was all in that area. And the more I was realizing, doing all of this body work, I was like, it's that spot where the hook is. Let's get that hook out. So called my doctor again, and I was like, I want it out. I was like, I'm not asking for opinions anymore. I'm telling you that I want this hook out of my back. I had to go through a couple more neurosurgeons before I found one that actually validated my pain. I don't know if my bar was low or if the doctor I ended up going with was actually amazing, but he was the first doctor I talked to where I told him kind of a quick history on my pain, and he was like, oh, that's really hard. And I was like, it is. It has been really hard. And he was the first one, and he was like, well, I think I can help you with that. And it was just like the simplest statement. I was just like, really? And so he was a great doctor, and then that is when we decided to do the second spine surgery to take out that hook. And I had that surgery back in April 19th was my surgery day. That one I was so much more prepared for. I did specific exercises every day. I was doing all of my physical therapy exercises that I could remember. I was doing weightlifting and yoga every day. I stopped doing all of the back bends or things that would hurt. I was just so focused on making my back as strong as possible going into surgery. Being so blindsided with the first surgery, I was expecting this one to be so much worse. So this time when I woke up, it was a much smaller surgery. They just had to go in and take out the rod as opposed to putting in a rod. They had to take out about this much of the rod and one of the cross links. So they took out a little bit of it, but the rest of the rod is still there. They only cut off the spot that was sticking out. So that surgery went by so much simpler than the first one. I woke up and I was like, did you guys do it? Did you do the surgery? And they're like, yeah. And I remember asking them if I could see the hook so I could say goodbye. And they were really weirded out by that. And I was like, well, this has been in my body for 11 years. I can't just throw it in the trash. And they're like, we're not really allowed to do that, but I'll see what I can do. And then before I left, they gave me the hook, and they let me hold it and take it home. And seeing the hook for the first time was such a trip because, in my head, it was the size of an iceberg or something. It felt so big. And it's what if this whole time the hook was that big and I was just being dramatic or something. But seeing it and seeing really how sizable it really was. This was stuck between my scapula and my spine. Of course I was in so much pain. It felt, again, very validating to be yeah, it makes sense that my back was hurting because this was stabbing me the whole time. And so then the aftercare was completely different from last time. And I insisted on physical therapy, and even with my good doctor, he was like, and if you don't think you need physical therapy, there's no need. And I was like, I need it. I was like, no, I need it. I definitely need it, and I'm insisting on it. So now I'm a little over 3 months out from that surgery, and I'm doing physical therapy, and it's hard. It's really difficult to use those muscles and wake up those muscles that have been in pain basically my whole life. It's so much more empowering to actually have something to do every day to make this manageable, and I think that's something I've realized in the last couple of years is that there isn't going to be a moment where I just wake up and everything is better, but I can make things more manageable. I can stay functional. And just knowing that, I think, has been really helpful for my mental health. Just knowing, just giving me some agency, something to do to help in any way.
What is it that you wish you knew before? I mean, you mentioned a lot that you felt like you were just so in the dark.
Yeah.
And it's hard because these authority figures who you assume are there with your best interests, and probably in their mind they are.
Yeah.
You know, what is it that you wish you had just heard or been told differently back then?
I wish a couple of things. One, physical therapy. Just like I wish I was given some kind of tool to help, specifically after my surgery, but also just like throughout time. You know, like I wish the second that I got diagnosed, they gave me exercises to do. I think that would have helped me feel more in the driver's seat the whole time. Probably would have actually physically helped with my pain. So I really wish that happened, that I had known to insist on physical therapy. But also, I wish somebody talked to me about my pain and about what it would be like to live with pain and to be uncomfortable the majority of the time. And really, what does that mean? And what does that entail? And I think that's something that I'm still figuring out. Like, if this isn't something I'm over, like this is something I'm still in and I will be in for the rest of my life. I didn't even realize that I counted as a person as somebody having chronic pain. Like, I didn't even think that was me. I thought that was something else. And they're just like, well, are you in pain chronically? And it's like, yes, I am. They're like, then you have chronic pain. And it's like, oh. And it's like, oh, what does that mean? Like, that means that a lot of my everyday energy is going to be siphoned off always. Like there's always going to be something kind of taking. Just mentally, I wish I had that knowledge, and emotionally, I wish I had that knowledge. And also, I didn't know other people had this pain, because every time scoliosis was brought up, it was very casual. They would always say, yes, some people experience some back pain. And I was like, okay, well, I'm experiencing a lot of back pain. Am I doing something wrong? You know, like, it's like I thought I was doing it wrong because my back really hurt. And it's like, I wish I could have commiserated with somebody else. And that's why when I was talking to you about it was so emotionally validating of like, oh, okay, like this is normal. You know, like I thought I was wrong and being dramatic or like maybe this is what everybody's back feels like and I just can't handle it or something. And it's like, that's not true. Like there's genuinely something going on. And your pain is very real and other people feel it too. And I wish I was given some kind of like holistic book or like toolkit or something of like, this is what to do, you know, of like reminders. But it was always just like little bits of information that I had to put together myself over time. And I'm still learning about it. Like, I'm really excited to learn about the exercises that you're doing, because I'm like, I'm just kind of doing these exercises that I think are good, you know, like that other people are like, this should help. But even, you know, the physical therapist I'm working with now is fantastic, but she's a generic physical therapist. You know, I've never worked with somebody who specifically works for scoliosis. Like, this is about your spine. Like, so I'm doing exercises that are good for your spine, but that might be good for a regular, normal spine, whereas mine is not. And so,
I feel like a common theme with both of us is the reaction of our doctors. Mm-hmm. Like, from day one, it's just this very dismissive
dismissive.
Well, it's on you, kid, vibe. And
Yeah.
I think that that's something that, like, I don't think doctors are evil. I think you hopefully become a doctor because you want to help people.
Yeah.
But I think it's unfortunate because that's something that comes up so often in our stories, and it comes up so often in the other people's stories of other people I've met with scoliosis.
Yeah.
And I just wonder if there's not like, you know, I think chronic pain is often misunderstood. I think sometimes because we're women, it's dismissed that our pain is somehow not real. Like and I think I have such a trigger. I've freaked out in doctors' offices so many times about that.
I did too. I definitely, especially with that first doctor who, that first neurosurgeon who basically laughed off my pain, it was so invalidating. And I saw like 3 or 4 doctors where they just like did not take my pain seriously, or when I was telling them about it, they're like, yeah, well, there's nothing you can do. And it's just like, what? Yeah.
Well, and it's strange to me because doctors study the human body. They know the insane things our bodies are capable of. Like, you know, the fact is that we can grow things like a tumor the size of a watermelon. We can also heal from a tumor the size of a watermelon.
Yeah,
You're like, I mean, our bodies are like just these incredible machines, and they know this more than anyone, and then they kind of become so black and white about your odds and stuff. And it's, I don't know what causes it, but I feel like it's something that like they need to think about in the presentation of what they're offering a little bit.
Completely. And like I'm a huge advocate for doctors. My dad works in medicine. Like I've had great doctors. You know, they're heroes. Like that's why most people become doctors, is because they want to help people. I don't know if it's our specific medical system in America or what happens if it's these people, like eventually their spirits get killed or something. But so many of the doctors I've talked to, specifically since becoming an adult, it's like, do you even care that I'm here? Like, am I inconveniencing you by being here telling you about my back pain? Because that's what I thought that's what your job is. But yeah, I don't know if it's as simple as bedside manner for doctors, but like, I feel like I would have benefited from being treated like a whole human being as opposed to just like a 15-minute time slot, you know? That's kind of how I felt a lot at the time.
So what would you say is your pain now?
Right now, my pain is at like a 3 or so, and I think 3 is pretty good for me. Like that's a really good day. You know, and it's hard because I am still relatively post-op, that there's like a lot of numbness still, or just like healing pain. But overall, and specifically in that area, it's so nice having room to like do this, and it's not, my scapula isn't running into some hunk of metal in my back. Like, it just feels like there's so much more room, and like, honestly, like it kind of feels like my body was rejecting that piece of hardware in a way. It was like, I don't want this here anymore. So I think the healing process has been much more graceful because it seems like something my body actually wanted out is now out, and so I'm in a more optimistic place with my back.